I am Professor Dr. Vivek Gaur. I am a maxillofacial surgeon and I am practicing in Kaushambi, Delhi NCR. My clinic name is Implant Clinic, and this clinic is specialized for doing a corticobasal implants. Corticobasal implants means immediate functional loading implantology, and we practice and we operate and we do the implant implants. They are the pioneers in immediate loading. They are the first in the immediate loading, and they are from Switzerland. Now this is actually a very common question is there, and you really want to have the answer. That one doctor is providing the cement retained prosthesis and the other doctor is there that can provide the screw retained prosthesis. So what is the differences there? The difference is cement retained prosthesis means there are the certain implants are there, like these are implants are there. This is a single piece implant is there, means it has the single piece is there, the cap, the crowns or the teeth are going to get cemented. So when the teeth are going to get cemented, so it will be like fixed forever. And what is a screw retained prosthesis? Screw retained prosthesis is there's a different type of implant is there. It is called a multi-ute implants of the same brand of Simplant and Dental. Here we are fixing the teeth, fixing the prosthesis with the screws inside. So what is the difference is there? The difference is that if I want to remove the prosthesis in any scenario, so I just have to unscrew it and the whole prosthesis I can remove. If I am using a cement retained prosthesis, then I have to cut down the prosthesis. It is a tedious task is there, and then I will be able to remove the teeth or prosthesis. So guys, now there will be a question will ask that if it is easy to remove the prosthesis, then why not to go with the multi-ute implants, mean screw retained prosthesis? Definitely you have the answer. Yes, you are right. But now I am going to tell you the difference between the screw retained and the cement retained. As you see, this is a screw retained prosthesis there, this is a screw retained prosthesis there, and that is a cement retained prosthesis there. So when I am going to use a cement retained prosthesis, the prosthesis will be less bulky because directly it has to go and cement on the abutment. But when I am going to use the screw retained prosthesis, my prosthesis will be bulky, my teeth shapes will be bulky. You know why? Because the screw has to go inside. That is the limitation of screw retained prosthesis is there. What I want to say, if I am using a cement retained prosthesis, the prosthesis is less bulky and patient is more comfortable in his speech and everything. If I am using a screw retained prosthesis, the prosthesis is bulky and patient have to adjust with the bulk. So in the end, when I really want to create an aesthetic results, I always want to go with the minimum width of the teeth so that it comes to as natural as possible. Yes, the advantage of a screw retained prosthesis is that I have to not to cut down, I can remove the prosthesis. But why it is needed to remove the prosthesis? That is the major question. It is when there is a chip off is there, there is a fracture is there. I agree if I am going to go with the metal to ceramic, yes, it will be advantageous. But if I am going to do with the graphene or the zirconia, it is already done over the metal framework. So if any chip off is there, if it happens, I just can correct it without taking out the metal framework. So it will be done like within half an hour or 45 minutes. But with the ceramic, if it is only one chip off is there, again it can be done within half an hour. I can just do the sort of a capping preparation and put an onlay or a cap. Advantage of cement retained prosthesis is once it is done, the doctor is not bothered at all that it will get loose. But with the screw retained prosthesis, always please remember when you have a screw retained prosthesis, it will get loose and you have to periodically you have to call the patient to check whether the screws are tight or not. Simple example, one of my colleague has shown me. You have actually the T-pan is there. The T-pan, it is having fixed actually with the screw, the handle is fixed. So you find out whichever the best quality you are using, obviously within 6 months or 1 year or 3 months, 6 months, 1 year, you always find out your handle will always become loose. It's as simple as that. So both the things are good, but there are the advantage and disadvantages there. And believe me, just have a faith on doctor and he's the best person to decide for you which is the best thing for you.